Hello, everyone. Welcome to the pitch session for 40 Under 40 Public Health Catalyst Awards. This is for North America. And what we're going to do first is folks start trickling in. We often have folks come in a little bit later. We're going to test our cameras, make sure everybody can get on camera. But before we do that, I did want to introduce myself. My name is Dr. Circe Lecomte. I'm co-CEO of the Boston Congress of Public Health and co-editor-in-chief of BCPH Review. And very wonderful to have you here today. And before we start testing our cameras, I'd like to pass it off to my colleague.
Yes, thank you so much, Dr. Lecomte. So Dr. Carpenter here, the other co-chief executive officer and chief strategy officer for BCPH. Pleasure to see all of you. Very excited to hear all of your pitches.
Yes, yes. So next thing I'm going to do is I'm going to make everyone a panelist, and we're going to test our cameras to make sure that you can immediately come online when it's your turn to pitch. So let's get that started. First, I make everybody allowed to talk, and then I promote you to panelist.
All right, I see Colleen. Fantastic. So we want to see everyone turn on their cameras, and then at some point we will ask you to turn on your audio just to just to make sure so we don't have any lags. James, we see you.
And this
Juliet.
comes from experience. Sometimes folks don't realize they're going to have trouble sharing their screen until the very last moment, and we don't want anyone to have nerves.
Yeah, Mame, we see you. Morgan, we see you. We're still waiting on a few additional people. Let's see. Who else? Yvette, we see you. Nice to see you. Long time no see.
Right?
All right. Jewel, we are just waiting on you. So for people just filtering in, we're doing just a quick camera check and then an audio check. So if people can turn on their cameras, just so we can very fluidly move through the whole process. All right, perfect. We see you, Jewel.
Olabiyi, I believe you are in a bit of a YouTube ephemeral space at the moment. I've promoted you to panelist, but you're still here, and I also see you there. I don't know if you're going to be able to share your screen just yet or share your video. Oh, you declined to be promoted. Okay. Great, great. All right. If everyone could just say hello so we know that your audio is working.
Greetings.
All right, heard that.
Hello.
Hello.
Good afternoon.
Hello.
Hello. I think that is everyone. I heard everyone.
That's everyone. Wonderful. So after all that, I'm going to make you all attendees again.
All right. I feel like I've seen a number of people's names before. This is not the first time we have met, I feel. Right.
Okay. So what we're going to do is we're going to go in alphabetical order here. If you look in the participants section, you'll see first up is Colleen, then James, Juliet, Jewel, Mame, Morgan, and then Yvette. And what's going to happen is this. We're going to say your name, and you're going to come on the screen and you're going to do your 3-minute pitch. I'm going to start the timer, and you're going to see it over in my the left-hand side of my screen. And at about 1 minute left, I'm going to send up some emojis so you know that you're coming to the end of your time. And once it hits about just before 3 minutes, a little bit of music's going to play to escort you off the stage. And then we're going to move to the next person. But please know there's no offense or anything if we don't show a lot of emotion or anything during your talk. We're just listening, and we want to get to know everyone. And please feel free to engage with each other in the chat. This is like a supportive space. We're all public health folks. So, Dr. Carpenter, did you have anything to add as we?
I'm all set. I think we just want to take Olabi off the pinned or the panelist right now because they are still hovering on my screen. There we go.
Yes, they should be off now. They were caught in the
Got it. Okay.
The ether, the Facebook, the Facebook, Zoom ether. So let's show our timer. So the first person is going to be Colleen, and I'm going to allow you to talk. And I'm going to bring the timer up. Hello, welcome. And
hi, thank you for having me.
Thank you for coming. And so what I'm going to do is I'm going to click start on the timer. And once you see it on the screen, you can begin, and we're going to be happy to listen.
All right, sounds good. Hi, everyone. My name is Colleen Nguyen. I'm the Executive Director of Asian Women for Health, a local nonprofit organization based in Boston, Massachusetts, in the United States. I lead work at the intersection of community health, workforce development, and community engaged research, focused on advancing health equity for Asian American, Native Hawaiian, and Pacific Islander women, their families, and historically marginalized communities across really all of Eastern Massachusetts. And I'll say this pretty plainly, which is if you look at the data, I'm not supposed to be here. Contrary to the dominant narratives about ANHPI communities in the United States, Vietnamese Americans often do not benefit from the so-called model minority outcomes. And my path to public health in my career has never been linear. As the daughter of Vietnamese refugees myself, I grew up in the in-between, between languages, between cultures, and between what doctors said and what my family actually understood. And truthfully, I still play that role today. And what I learned through that lived experience and later working at the international rescue community serving refugee families like my own is that access isn't about services, it's about trust, dignity, and being seen. And really my lived experience in that work is what brought me to public health, and not just to improve systems, but to reimagine who they're built with and who they're for. And over the course of my career, I've worked across data, research, and community to close a number of these gaps. At Boston Children's Hospital, I worked in the computational epidemiology lab, where I led and managed projects like a Vaccine Finder, a national platform that helped people locate vaccines in real time, which later became the driving platform behind vaccines.gov during the COVID-19 pandemic. And that works at the intersection of data access and public trust. At the Broad Institute of MIT and Harvard, I focus on cultivating trust and transparency between scientists and communities within critical genomics research, while also reimagining who is included in science and who gets to actually shape it in some of those questions. And during my time there, I led efforts to rebuild their research pipelines across cancer, with research equity at its core and foundation. I cultivated partnerships with more than 80 organizations across the country and worked alongside patients and communities as collaborators, helping to expand representation and contribute to research efforts that reached over tens of thousands of individuals. Today, as the Executive Director of Asian Women for Health, I lead efforts that center lived experience as expertise. We train community health workers from local communities most impacted by health inequities, not just to bridge gaps and navigate systems, but to transform them. And we also create mental health spaces where young people who may identify as ANHPI and or queer can connect and speak openly, sometimes for the first time. We partner with researchers across academia and industry to ensure that communities are shaping the questions and not just answering them. And in parallel, I've continued my academic pursuits, recently authoring a comment in Nature Mental Health, highlighting the role of lived experience in shaping science and care from a funding perspective. More recently, I was appointed to Mayor Michelle Wu's Live Long and Well Advisory Council in Boston, where I'll contribute to shaping citywide strategies for the next 2 years. And recognition through this award would help scale this work even further, expanding workforce pipelines, deepening community partnerships, and continuing to hold and build systems that are not only more equitable, but more accountable to the people they serve, continuing to shift power so that the people in closest proximity to these challenges are also shaping those solutions. Thank you.
Thank you. Thank you. I could tell you were getting to the end there. That was great. That was great. So thank you very much. Thank you very much. And so I'm going to be sending you back to attendee land. And thank you very much. And we're going to move on to James Arthur. I'm sending you over to be a panelist.
Okay.
Let me see. James, if you can start your camera.
Oh,
Here we go.
okay.
Sometimes it takes a little while to convince Zoom to let you do your camera. Hey, how are you?
I'm doing
I
good.
can. Great, great. I'm going to welcome. I'm going to start the timer as you saw with the last person. And once you see it, we're going to be ready to listen.
All right. So good day, everyone, and thank you for this opportunity. My name is James Arthur, and I am a public health professional. I'm a researcher. I'm a counselor in training at the Ballard Health Woodridge Hospital here in Tennessee. And I'm also an educator committed to advancing health equity through data, advocacy, and culturally responsive care. So what drives my work is simple, but an urgent belief that public health must do more than just describe disparities. It must actively challenge the systems that create them. So my background in psychology, health administration, public health, and mental health counseling allows me to approach these health inequities from both humans and then systems perspectives. I have worked in healthcare and public health settings, both in Ghana and then the United States. And these experiences have taught me that inequity is rarely accidental. It is often built into access, policy, geography, stigma, and the ways institutions decide whose lives are prioritized. So in my current work, I have contributed to research and advocacy focused on mental health equity, HIV prevention, and the support for marginalized communities, particularly in underserved regions such as the Appalachia where I live. I am involved in policy-oriented HIV policy, where the goal is not only to generate evidence, but to help move that evidence into action. At the same time, my clinical training has contributed to my understanding that equity must be relational. So this work reminds me every day that behind every data set is a person that is navigating some sort of pain, survival, identity, and hope. I also see public health as a space for mentorship and developing the knowledge and confidence to serve communities with which students to serve communities with dignity and ethics and also cultural humility. So for me, leadership is not only about visibility, it's about making room for others, especially for those whose voices have been historically excluded. And what makes me a catalyst is that I work across boundaries that are too often kept separate, so such as data and compassion, policy and research and community voice. So to be recognized as part of the 40 under 40 public health catalyst would be deeply meaningful, not simply as a personal honor, but as an affirmation to the kind of public health leadership that I continue to embody. So leadership rooted in equity, leadership rooted in social justice, and leadership rooted in collective liberation. Thank you.
Thank you so much. And it's nice to see you. I was so glad you
Nice
were
to see
able to
you too.
join.
Thank you.
Yeah, yeah. So I'm going to send you back to the attendee
Okay.
section. So with that, we're going to move on to Juliet. Oh, and it started playing its little song. Juliet, hi.
Hi, good
Welcome.
afternoon. Thank you so much.
Yes, I'm going to start the timer, and when you're ready, we'll be ready to listen.
Wonderful. Thank you so much, Dr. Lecompte and Dr. Carpenter, for giving me this incredible opportunity to amplify my voice and to be nominated for this incredible award of social impact. I'm Juliet Lamati. I'm Assistant Professor of Surgical Oncology at Northwestern University. I'm also the Assistant Director for the Center for Global Surgery and affiliated with the Center for Global Oncology. I consider myself a health services researcher within the context of global oncology. I've been in the global space for the last 15 years. I started my background being born and raised in Nigeria, where I grew up with a single mom that had significant financial hardships trying to afford to take care of 3 kids. And this experience has really launched my enabled my commitment to really understanding how to address financial barriers for financially vulnerable populations. Recently, over the last decade, I've spent my work in sub-Saharan Africa, in Ghana and Nigeria. I worked for Senator Tom Harkin before going to medical school, and that really ignited an interest and experience in merging clinical medicine with healthcare policy. So I spent the last 15 years of my work looking at healthcare financing and how to address financial barriers for cancer patients. And more recently, over the last 2 years, I launched the first pragmatic trial on financial navigation for cancer patients in sub-Saharan Africa through the African Research Group in Oncology and NCI Designated Cancer Consortium. This trial has recruited over 200 patients, and the early results of this trial show that we have gone from a 50% treatment abandonment rate for breast cancer to 0. And this is an incredible trial because it's a landmark trial and is the first ever trial of this particular nature. I was recently awarded the Global Humanitarian Outreach Award by the AHPBA Society, as well as the Presidential Scholars Program of SSO. I was the first Black and African American female to graduate from surgical oncology at Johns Hopkins. And so this award will mean an incredible opportunity for me. My long-term goal is actually to open up the glass ceilings for LMIC investigators as well as underrepresented minorities. And so having this award will show people that it is very possible to come from a resource limited setting like Nigeria to dedicate your life to actually addressing financial barriers and not just describing the disparities. Now, after 15 years of doing this work, I actually have a solution. Thank you so much for this incredible honor and opportunity, and I look forward to being considered as a finalist.
Thank you so much, Juliet.
Juliet.
Wonderful, wonderful. I have to say, like, even before we get through the rest, everyone's been so amazing so far. I'm going to send you back to the attendees. But now we look forward to hearing from Joelle. Joelle, are you able to share your camera? Hi. Hi.
Hi, how are you? Thanks for having me.
Yes, so I'm going to restart the timer here. Welcome, and we look forward to hearing your pitch as soon as I start the timer.
Okay. Greetings, everyone. My name is Dr. Joelle Harley, and I'm from Jamaica. I'm a registered nurse, educator, and public health advocate with over 12 years of clinical and academic experience. My work spans from nursing education, community health development, and health equity initiatives, with a strong focus on empowering the vulnerable population and strengthening healthcare system. My journey into public health was inspired by first-hand experiences in clinical nursing, where I recognized the deep connection between social conditions and health outcomes. Over time, my passion evolved beyond bedside care into education, research, and community outreach. This led to my pursue advanced studies including master's in education and PhD in humanities, enabling me to address health disparities through both academic and practical lenses. I'm the co-founder of Tech Savvy Nurse, an initiative that bridges the gap between healthcare and technology by providing essential resources such as laptops, blood pressure machine, thermometers for nursing students. Through this organization, we also secure grants and scholarships to support future healthcare professionals. Also, I'm a board member of the Joseph and Vera Douglas Family Foundation, where we contribute to the program focused on women's empowerment, community development, and mental health support. My accomplishments include I'm also a sexual nurse practitioner, a certified global nurse consultant, certified global breast health educator, board certified master mental health coach, just to name a few. Other accomplishment includes I've written a book, Fun Facts Pharmacology, mentoring student nurses into embracing numbers and pharmacology. And also I have my own blood pressure machine brand, Pure Heart by Dr. Joel Harley. Other accomplishments include me being the recipient of 4 major international awards, including the Guiding Star Award USA, Global Recognition Award USA, Most Inspiring Nurse Award, Qatar, and Pharmaceutical Education Excellence Award in the UK. I thank you.
Wonderful. Thank you so much.
Thank you.
Yeah. So I'm going to be sending you back to attendees.
Okay.
And next up is Mom. I'm going to make you a panelist. Promote. Hi, welcome. Let me
Thank you
bring
so
the
much.
timer up. Thank you. Once you see the timer over here, you can begin.
Okay, thank you so much for this opportunity. My name is Mame Araba Udro. I am a physician with over 5 years of clinical experience and a public health professional working at the intersection of medicine and public health. And over my years of experience, I've come to realize that structural barriers facing rural communities in Ghana and underserved populations here in the US are not as different as we think. And this equity lens has been a force that drives everything that I do. So I graduated with a master's in public health at the University of North Carolina at Chapel Hill, where I currently live. I work as a research assistant at the University of Buffalo's Thrive Lab, where I participate in implementation science projects and research studies among African immigrants, social networks, and health outcomes. I also serve as an operations specialist for Generator Health, where I contribute to improving health, where I contribute to AI-driven healthcare solutions, improving medication access, and patient and provider communications. I interned with the Durham County Department of Public Health, where I conducted expert interviews and focus group discussions with community members to examine how public health departments contract with community-based organizations. My 5 evidence-based informed recommendations prioritized including people with lived experiences in such contracting process, because real equity means that the people who are most impacted by the systems have power within the systems. I also co-authored a publication in the Studies in Family Planning on recommendations in family planning measurement, where we found that most programs use standard measures and very few tools are made to actually find out what individuals prefer, want, or are able to achieve. So our recommendations push these individual agencies at national, global program levels. I am a 32-year-old building a career in medicine and public health, and I hope that this award helps me to amplify my work and to improve on public health systems and medical systems in terms of health equity. I haven't just studied health disparities, but I've lived in them. I have treated them, and I'm dedicating my career into closing the gaps. Thank you very much for this opportunity once again.
Thank you. Thank you. Lovely. I'm going to send you back to being a an attendee, and that brings us to Morgan. The music starts playing. Oh, Morgan. Okay, Morgan's showing. Hi, how are you? You're on mute.
Sorry, I just noticed that. Sorry, I'm good. How are you?
Good, good. So once the timer comes up here, you can begin. And we look forward to hearing.
All right, good afternoon, and thank you all for having me. My name is Dr. Morgan Grant, and I'm a postdoctoral fellow at the Bloomberg School of Public Health at Johns Hopkins University. My path to public health, or my interest in public health, began at a very young age of 8, when my mom was diagnosed with both lupus and epilepsy. Her diagnoses taught me that no one person knows all of the answers and perhaps never will, but that potentially my purpose in public health is to do what I can to help others. So as a public health researcher, I am very interested in suicide prevention in at-risk and minority populations. If you've been following what's been happening with adolescent suicide in the United States, over the last few years, the rates of Black adolescent suicide has increased drastically. So part of my research is to try to understand why. So I look at a variety of factors. One being, what are they experiencing in schools as far as victimization? And through this work, I became aware of a huge gap in suicide research for Black people, that there is actually no screening tool that takes into consideration all of the various experiences and identities that come with being Black. What I recently proposed and published is a new conceptual model called the Individual in Context Model for Suicide in Black Communities. For this conceptual model, my collaborators and I were awarded the 2024 Theory Impact Award from the Journal of Human Services for bridging this gap between theory and practice in the field of human services. I have nearly 16 publications, both published and in press, and another 5 under review. I'm hopeful to receive future funding from the American Foundation for Suicide Prevention to further psychometrically develop the individual context screening tool for Black people. I also want to mention that advocacy is integral to my work. So I am currently serving on the board of directors for the Foundation of the American College of Epidemiologists, and currently the deputy academic editor of the international journal Critical Public Health. I'm extremely proud of the work I do, and receiving this award cements my desire to continue being a voice for others, and it would also help to shed more light on the issue of suicide in Black children. Thank you all for your consideration and time.
Thank you. Thank you. That was wonderful. I'm going to send you back to being an attendee. So, oh, and it's playing the music. Olabi, I think that you are an attendee rather than someone who's presenting. Just if you could just note in the chat if we're correct about that, because I noticed you didn't want to be placed into the presenter pool earlier. But if I'm wrong, let me know. And then, so next up, I'm going to go to Yvette. Allow you to talk and bring you over. Hi, welcome. So you know the drill by now. Once I have up here my magic timer, you can begin, and we look forward to hearing.
Thank you. Well, my name is Dr. Yvette Efebera. I am currently based in Washington, D.C., USA, and I am working to build a world where girls and women can be healthy, happy, unafraid, and unapologetic. I am the founder and CEO of She Thinks Group, where I work as a strategic architect for social impact, which today translates into using strategy and different collaborations to help funders, collectives, and organizations redesign how change happens at the intersection of global health, gender equality, and whenever possible, youth. My pathway into public health started long before I had the language for it. And it was deeply shaped by my mother and my grandparents, who had values around community, education, girl power, and equity growing up between the United States and Nigeria. But my passion really crystallized while in high school, I spent a summer, a year in Namibia, and I got to volunteer with an AIDS orphan center there. And it really made clear to me that the biggest challenges we face are not just about resources, although those matter, but they're about systems, power, and who gets to lead. Since then, I've worked across research, policy, nonprofits, and philanthropy across countries like Senegal to Malawi to Harvard University to the Gates Foundations, all focused on shifting those systems. So, over the past several years, as I think about impact, I have helped to shape more than 100 million US dollars in investments for girls and women globally, supporting initiatives that not only deliver services, but change how funding, leadership, research, and advocacy work. I have more than 35 peer review publications. I've been selected to speak at more than 60 different engagements and keynotes. I've won several honors and awards. But what matters to me is not just about scale, it's about who is centered. And whether that's supporting girl leaders in Africa to lead solution building in their own communities or rethinking how institutions themselves make decisions, my work is truly about making equity real in practice, not just in principle. I'll conclude by just saying that whether it is trying to create a world that is better for others, including my own daughter, I am truly excited and honored for the opportunity to have a platform where my work can be amplified and where others can also be a part of a more just world. Thank you.
Thank you. Thank you. So it's lovely to see you. I'm going to put you over to be an attendee. Well, I must say, it was just wonderful to hear. So Alabi, if let's try and have you come over, and if you can try sharing your screen.
We
think
do
it's
know these things-
working.
We do know these things happen as that's being managed. I want to say thank you to everyone else who's gone. It's been fabulous. We always love to say this, that you make our jobs difficult, but yet at the same time, so incredibly rewarding for all of the diverse public health accomplishments, that you're doing all over the US, but then also obviously around the world as well.
Yes, yes. And it looks like Alabi, we can't see you. But are we able to hear you?
Can you hear me now? I couldn't
Oh,
hear you.
hello.
Can you hear me now?
Yes,
Can you hear me now?
yes. I can hear you.
Okay.
We can hear you.
So can you restart the time and then I'll start?
Sure. Let's do that. So thank you for joining. And once you see it, you can get started.
Okay, thank you very much. Hi, everyone. Good afternoon. Martin Luther King once said that injustice in health is the most inhuman form of inequality. I did not understand that as a quote first. I understood that as a reality. I grew up watching capable people suffer, not because medicine lacked answers, but because systems failed to connect knowledge, financing, and access. That realization shaped how I practice public health, not as an isolated intervention, but as an architect. My name is Dr. Oladero Olabiyi. I'm a physician and a public health systems architect, building bridges between innovation and equity across continents. I trained at the Benjamin Carson School of Medicine, Babcock University, and earned my MPH from Harvard THN School of Public Health. Today, my work operates across three interconnected layers of health systems. At the frontier of innovation, I serve as a clinical research fellow at Spatial Laboratory, contributing to the development of CardioVis. As an AI co-pilot for cardiac surgery, we are integrating hazard awareness, anatomy-guided navigation, workflow intelligence, and decision support directly into the life of surgical environments. Our work has secured over $100,000 in funding, earned best paper recognition, and contributed to multiple peer-reviewed presentations at the American Heart Association. This is not theoretical innovation, it is intelligent infrastructure embedded inside patient care. At the operational core of health systems, I serve within the Division of Vascular and Endovascular Surgery at the Beth Israel Deaconess Medical Center, immersed in surgical workflow, epic care coordination, and multidisciplinary clinical operations. There, I see how policy, reimbursement, and hospital systems directly shape patient outcomes. And I remain grounded at the human level, serving as a mental health technician in clinical trials for depression, alcohol use disorder, and schizophrenia. Working directly with vulnerable participants reminds me that equity must extend beyond innovation into dignity, safety, and trust. Beyond delivery systems, I engage in policy and global equity platforms. As a co-chair within the HIV/AIDS section of the American Public Health Association, and as a Fenway Health Activist Academic Fellow, I contribute to national conversations on health justice. Internationally, I help design AI-enabled epilepsy care in Uganda, integrating telehealth, community governance, and sustainable agricultural financing, because systems must be durable and not donor dependent. In financing research, I've analyzed over 4.5 million development projects and found that cardiovascular disease, the leading cause of death globally, received only 0.008% of international development assistance over 16 years. That structural imbalance drives my mission, aligning body with investments. Along this journey, I have been honored with Public Health Excellence Awards, maternal and child leadership recognition, innovation awards within Harvard ecosystems, and best paper distinctions in AI research. BCPH honors leaders who catalyze a more just and equitable world. Justice requires architecture, equity requires system, catalyst builds bridges. This work I do across research, hospitals, communities, policy tables, and continents. And that is the work I will continue to do. Thank you so much. Thank you very much. Bye.
Thank you. Thank you. I know you're having some technical difficulties, but you still banged it out there. So I'm going to be sending you back to being an attendee. Sometimes it just, I think you're now kind of in a Zoom ether as you shift between roles. But just to tag on to what Dr. Carpenter was saying, it's an absolute pleasure listening to everyone's pitches today. Always makes our job incredibly challenging and difficult. We'll be in touch soon about next steps. If you move on to the next round, it would just be a matter of filling out the formal application. But truly an absolute pleasure and honor to listen to everyone today. And yes, and truly, how wonderful to see people again. Some haven't seen for a while, but.
Absolutely. And I'll just quickly talk again as well. You know, some of you may be receiving further follow-up from us. Please make sure that you do read the details about the award, because there are a few different things that I want to mention beyond just the application, okay? You know, in terms of like how we award members of BCPH, and you can become a member after obviously you pitch and you apply. So thank you so much.
Yes. And everyone who presented today is a finalist for the award, and you'll be receiving a certificate noting as such. So thank you. And with that, we're going to be ending the session. So, and one final time, I'll be sending up the cats. So, yeah. Thank you. And I met James last week in passing at a conference, so it was wonderful to see him here today.